Welcome back to Toledo Clinic TV. And we just wanted to spend the next few minutes chatting with you about healthcare and about you and your role. You are an internal medicine physician. What exactly does that mean? Is that different than primary care?
Internal medicine is a specialty, board-certified specialty that deals a lot with 18 and over patients, hypertension, diabetes, heart disease, but we deal with the whole spectrum of the patient, from age 18 through, I've got patients in my practice who are 90 plus years old. So we deal with everything from sprained ankles, back pain, to complicated patients with multiple medical problems and people who are on multiple medications. Internal medicine is a specialty, and quite often, or always, from that specialty, your cardiologist, your pulmonologist, your gastroenterologist subspecialize from internal medicine into one of those specialties. For myself, I deal with a little bit of all of that. So I'm a general internal medicine physician, and it's a wonderful field. I love it.
I was going to ask, why did you choose that?
Well, I like the broadness of it. I love taking care of the overall patient. I love being sort of the coordinator or the quarterback for the patient. It's my job to make sure that everything any of the specialists are saying makes sense to the patient. It makes sense to their overall health, coordinating their medications, coordinating what's happening for their overall health, making sure their preventive health issues are addressed. It's fun because you get a broad range of what you do through the day. You're not sort of focused just on the lungs or just on the heart. It's great, it's wonderful. And to deal with, I saw my 99-year-old in the office last week, and she's doing wonderfully. And just to see that and is just amazing.
And I would imagine you build really strong relationships with those patients. You see them over a long period of time.
You do. You see them when they're sick, you see them when they're healthy, you see them once they're out of the hospital, if there's been something going on, you see them for everything. And so you do develop. I've been here since 2012, and I've seen people over a long span. I've been fortunate enough to see patients, their children, their other family members. It's a wonderful relationship over the long term, yes.
Now, I asked you why that specialty, but why medicine in general? What was it that got you on that path?
Well, I love the science of medicine. I've always loved medicine. In undergrad, I did biology, and I enjoyed that. But I just love the science of what we do, of the medicines that take care of weight loss and diabetes and heart disease. I love the science behind that. But also the one-on-one contact. It's just, to see people every day, to get to talk to people, to lead them through illnesses, to make sure that they're healthy. The appreciation that you get from that is it's great.
As we were speaking off camera before, you have a military background as well, so tell us about that.
Well, I went to Case Western Reserve in Cleveland, Ohio, and I was fortunate enough to get a scholarship from the military to pay for med school. And so after that, I was a captain in the Army, and I got stationed all over the world for a lot of years. My wife and I got to travel all over Europe. I got some deployments as well, where I was in some situations where I was, in combat gear, and that was a different experience. But it was a great number of years, and so it was a great way to pay for school and a great way to serve my country. So,
yeah. Well, we appreciate your service.
Thank you.
And thank you for all that you do for people, for patients in this area as well.
Thank you.
We appreciate it.
Thank you.